Health Matters with Paul Rosen.
Our diets, our Western diets in America are just really, you just don't realize how poor they really are.
What would you say to others who would like to feel better?
Sometimes you need to find the instructions. That's where the testing and everything comes in, because without that knowledge, there's no way I could have got to the point where I'm at today.
Straight talk about health.
And then I start preaching and telling them what I've been doing. And this guy named Paul Rosen has changed my life.
With your host, Paul Rosen.
By the way, the information contained in this program is not approved by the FDA, nor intended to treat, diagnose, or claim to cure any medical condition or disease as defined by Western medicine. However, skilled practitioners of many disciplines have found nutrition response testing to be a highly reliable supportive technology for assessing the health and fitness of the body's functional system.
Paul Rosen, surely you've heard of Michael Phelps. Michael Phelps, the greatest Olympic gold medalist ever. He's won 23 gold medals, among others. He's won 28 medals total. Michael Phelps, as a child, Paul, suffered from ADHD. He certainly surmounted that and went on to be a great American and a great Olympian. So we know you can defeat that particular condition. And we're going to talk about ADD and ADHD this morning on Health Matters.
We are?
We are. I hope you're ready for that.
Shocking.
Because I sure prepared for it. I'm also impressed by your shades this morning, Paul. As you indicated, you forgot your glasses when you came to work today. So instead, you're wearing your sunglasses. So I've got
my Stevie Wonder specials.
I've got Elwood Blues sitting across from me today. I wish we were on video. We're going to try and get that going sometime when we can have the entire show on Facebook Live on video, and people can enjoy your new suave shades-wearing look.
Cool. The bottom line is I know many of you out there are taking all kinds of supplements, vitamin supplements, herbal supplements, using essential oils, maybe even utilizing some homeopathics, and not seeing results that you should see. And the reason for that oftentimes is that you have no plan, you have no strategy, you have no real way to know whether you're on the right track or not. Most of you are using the scattergun approach, throw it against the wall, see what sticks. And I did that for many years. And even as a practitioner, it didn't turn out good. It turned out, in fact, it turned out really poorly. And as it turns out, I wasted a lot of time. So if you have any real desire to be successful at utilizing nutrition and not medications, not poison, to restore your normal function and have a high quality of life, isn't it time that you actually got a strategy? Isn't it time that you actually knew where you were going and what you were doing? Almost every single interview that I do with patients who have come to see me who have been willing to share their experience on the show, that's basically what they say. They say they just got tired of guessing. They wanted the missing piece. They got tired of guessing. So I'm just addressing that out of the gate.
So, Paul, it sounds to me like you're speaking in general terms about issues people may be facing and the fact that maybe they shouldn't wait until disaster strikes before they start seeking solutions. But in particular, what about ADD, ADHD? First, what's the difference between those two things? Are they the same? How do they relate?
Well, they're really not well, I would say they're of an ilk. They're of an ilk. So they're not necessarily the same. But they are described, the same, except for the hyper aspects of the inattentive or lack of attention syndrome, and the ADHD is the hyper aspect.
So hyper actually means hyper
inability
behavior.
to focus, inability to concentrate, inability to and then the hyperactive traits are like inability to sit still, fidgeting all the time, those types of things.
So some might immediately assume those kinds of conditions are partly caused by environmental factors, the other people around you.
Well, no, that's not the main cause at all. Although there's the environmental factors are, can be aggravating factors for sure.
But that was the point I was getting to. Many of us may assume that, but in reality, the main cause is something else.
Well, in reality, it really turns out that for many of the behavioral, how should we say, confusions or dysfunctions or whatever, the Psychiatric Society loves to label things, put labels on things, take symptoms and kind of put them in a basket and then put a title on it and then call it a disease. And the reason for that is because nobody gets paid from insurance companies unless you have a recognized title for a disease. Right? I mean, there are so many syndromes, obsessive compulsive disorder, obstructive disorder. There's, oh my gosh, mathematics disorder. The list goes on and on.
Mathematics disorder.
Yeah, if you looked into the DSM manuals, you would wonder if there was any behavior of a human being that was actually considered normal. And ADD and ADHD are real conditions, but they're not diseases, right? And the solution lies most always in what you put in your mouth.
I'd like to note, too, Paul, that when we walked into the studio this morning, something that caught our attention and could have caused us to be distracted was the fact that it was a sauna in here when we walked in. Did you happen to notice that?
It's totally a sauna.
And now it is not. It is very comfortable all of a sudden because we were able to adjust the thermostat. We had to use a lug wrench to do it because the cover is off the thermostat and it's looking pretty rough, but we found a way to turn the temperature down, so now we're very comfortable. And my point with that whole fascinating anecdote is, are there changes we can make to our environment as well as our diet to help deal with conditions such as ADD?
Are there changes in our environment?
Sure.
Or you are really stuck on environment this morning?
Well, we're talking about total health, right? And first and foremost, nutrition is something we want to focus on, but also what can we do to change about, the way we conduct ourselves every day, where we work, where we live, what we do.
But when it comes to ADD or ADHD, it's all about what you put in your mouth. It's what you put in your mouth first and foremost. So if you're eating enriched flours or processed flour, if you're eating sugar, if you're eating vegetable oils, organic or not organic, then you're putting your body at risk.
In what ways do these foods have an impact on our bodies?
In
Is
every
it strictly
way.
Okay?
In every
So it's
way.
not strictly chemical reactions triggered by these foods.
No, it's the food itself, and then of course the subsequent chemistry within the body. When it comes to ADD and ADHD, the inability to focus, the lack of ability to maintain attention, right, is really oftentimes related to an imbalanced endocrine system. An imbalanced endocrine system. What's the endocrine system? The endocrine system is a group of glands that basically run on and also make hormones. And the one that's really critical when it comes to ADD and ADHD is the thyroid. Once again.
Yeah, it always gets back to the thyroid. So I'm going to assume that the foods we consume have a big impact on the thyroid. Is that correct?
Yes, exactly.
So this is one element. It's not the only element, but certainly that is a principal cause of some of these conditions.
What you put in your mouth. It's so important because it's overlooked. And you have an entire social culture, an entire governmental push, an entire corporate push for processed foods, and then saying, oh, well, they're organic. That makes it okay. No, it doesn't. organic or not. It doesn't. Diets based on whole grains most of the time will get you in trouble. Diets that include the consumption of concentrated sweeteners, like cane sugar, of course, but high fructose corn syrup or fruit sugars will get you in trouble all day long. Now, if you have an imbalanced endocrine system, and that includes the thyroid, and you will know the thyroid is included because of the ADHD, hyperactive symptoms that you're experiencing, fidgeting with the hands and feet, squirming in a chair, has difficulty remaining seated, runs around or climbs excessively, has difficulty engaging in activities quietly, acts as if their motor is being driven all the time excessively. What is with me?
I don't know, but those all sound like symptoms of somebody.
Blurts out answers before questions have been completed. Sounds like a really intelligent person to me.
Well, no, it sounds like somebody who may have some kind of anxiety going on. So is that correct?
Has difficulty waiting or taking turns, interrupts or intrudes upon others. I was a classic ADHD kid.
Really?
Classic.
So all those things, too, sound to me like kind of an alpha personality, too. I mean, somebody who wants to draw attention to himself and feels the need to dominate conversations.
That group of symptoms is then put in a basket and given a name, ADHD. Well, now you have a disease, so you must require some kind of therapy. Now, we know that surgery is not appropriate, or I suppose a lobotomy might be the, outlying approach. So what do we have? What does Western medicine have? They have anti-anxiety, anti-depression, and stimulants.
Just a quick note. I hope lobotomies are the far outlying approach. I hope we're not just reaching for that one every time we need to shut somebody down.
Me too. So the preferred method of treatment is, essentially medicate and encapsulate. That's the preferred form of treatment for these kinds of behaviors, right? Medicate and encapsulate. And so when you look at the medications themselves, it's horrifying at the side effect profile. It's horrifying.
So here are two things, Paul. Maybe that we're trying to fit too many conditions or symptoms under this category of ADHD. And then, of course, the point you're making now, medications, are they making the problem worse, or are they just failing to treat the issue?
Well, if you look at the experience of those in Littleton, Colorado, I don't know if you're familiar with
I am,
the
yes.
massacre there.
Yes.
Santee, California, Paducah, Kentucky, Red Lake, Minnesota. Every one of the perpetrators was on a psychotropic cocktail that started with an antidepressant. So what are we really doing? I mean, is our antidepressants, anti-anxiety drugs, stimulants, are they really worth the risk? Right? The most common stimulant was Ritalin. And I wanted to just share some of the side effects. Loss of appetite, weight loss, insomnia, headache, dizziness, nervousness, irritability, overstimulation. Now, isn't that interesting?
So was Ritalin...
Hold on. Isn't that interesting?
It is, but was Ritalin prescribed for kids who had attention deficit issues?
Yes. It was prescribed for me when I was in junior high school.
So it's been around for some time.
A long...
Well,
I see.
Speaks for itself.
Always willing to throw the barbs.
That was not a shot.
Always willing to throw the barbs.
That was not a shot. So it's been around for, 10, 15 years now.
Easily. Yeah. And isn't it interesting that in the side effect profile, that the symptoms are exactly the symptoms that supposedly the medication is designed to treat, right? So side effect, overstimulation, behavior to be treated, overstimulation. Interesting, huh? So restlessness, right? Behavior to be treated, restlessness. Unpleasant taste, dry mouth, nausea, digestive issues, addiction, phonetic tics, high blood pressure, increased heart rate. So my point is that potentially the side effects of these medications often totally outweigh the risks of experiencing discomfort. I know I took it for less than a few days because the side effects were just overwhelming for me. It turns out, as I learned much later in my adult life, that one of the reasons I had these issues was related to thyroid. My thyroid was hyperactive, and it was hyperactive in large part because of the food that I put in my mouth. My Cocoa Krispies, my Fruit Loops, my Frosted Flakes, my other types of, cakes, cookies, and candies, my pancakes and French toast. And, I mean, the list goes on. Did my parents know this? No, they absolutely did not. Totally unaware.
So to use your own experience as a guide, did you get off the medications fairly quickly because of the ill side effects?
I did. I just stopped taking them because they just made me so uncomfortable.
Okay.
I mean, I didn't say anything to any. No, I think I did. I think I went back to my folks and said, no, this ain't working.
Why wasn't it until much later as an adult?
Not to mention school was boring as heck.
Well, there's that. Why wasn't it until much later as an adult that you finally recognized that your diet, specifically all the sugar you had in your diet, was maybe really the chief culprit in your behavior?
It really wasn't until my health went south at 45 years old, and then I spent the next 7.5 years trying to figure it out, and ultimately ended up meeting Dr. Freddie Ulan and nutrition response testing, and then becoming a practitioner myself.
As we said a little while ago, Paul, people often come to you when they already have severe symptoms or they've tried other things. Unfortunately, you had to get to a pretty severe state of crisis yourself before you began to deal with things.
It's just so human, right? Because when you first start experiencing dysfunction, it's, okay, I'll do a little this and take care of it, because it doesn't usually come and stay. The symptoms usually come and go. Most chronic functional illness of all stripes, all ilks, kind of come and go at first. And then the next thing you know, they come and stay. And that's when people start to become frantic and start to look around. And then it's, the total breakdown that pushes some, and not all, by the way. I mean, I know there are a lot of you out there, folks, who are struggling and still haven't found the answer, still are looking for the missing piece, but are not willing to make the changes in your life that you have to make. I've seen a ton of them. So just falling apart sometimes is really still not enough to get people's attention, to inspire them to actually fix the problem.
So I mentioned Michael Phelps at the beginning of the show. He's obviously a very high achiever, suffered from ADHD as a kid. He found ways to surmount that, and being an athlete, we can safely assume that his conditioning and his diet were chief factors in getting him to a healthier state.
Yeah, I really don't know anything about his situation.
Well, I do. I'm reading it off Google right now.
I see that. But I don't know anything about his situation, and there are, just like me, I was able ultimately to, become involved in self-discipline. Basically, I learned to discipline myself in ways until I actually could resolve the thyroid issue. And by the way, the thyroid condition may not show up in blood work at all as an abnormality with your TSH or your other hormones that the thyroid operates, with. and the chemistry may be just perfectly normal. But you can't have hyperactivity. You can't have insomnia, for example, which is a reflection of hyperactivity. You can't have restlessness. You can't have inability of to maintain attention without having a thyroid issue. It's virtually impossible.
When somebody says, for example, Paul, I had pizza before I went to bed last night and I didn't sleep well because of that, are they really stating a fact? Does that have a direct impact? And my point with that is, you may go into a doctor and he may tell you one of the things you need to do to make yourself healthier is improve your diet. But how do you know what specific things you need to do in terms of your diet? We can follow a few general rules like cut out the sugar, but what do we do? How do we find out what specific foods we may need to eat or specific methods we may need to practice to get to that better state of health?
Got to have a guide. You got to have somebody who knows what they're doing, who can evaluate utilizing unusual methods so that you can get unusual results. That's what you got to do. I mean, that's what I had to do. And I'm good at this stuff.
The following is brought to you by AccuNatural Family Healthcare.
Things that are unhealthy. Number 9, home solicitors.
Hello?
Hey, can I interest you in a timeshare condo on the beach?
No, don't. Wait, what is that noise?
It's me, on your roof, pounding holes with a sledgehammer.
What?
Only one thing can fix this.
What?
A timeshare condo on the beach. And some shingles.
This is Paul Rosen, Clinical Director of AccuNatural Family Healthcare. Nutrition is more powerful than you can imagine. At AccuNatural, you can get results like my patient Flo.
I had results pretty rapidly, so much so that my doctor was thunderstruck. I mean, she could not believe it.
Do the right thing for your health as opposed to those other things.
You want to buy a water heater?
No, I don't want to buy a water heater.
You do now.
Visit Paul Rosen at the AccuNatural website for more details. AccuNatural.com. ACUNatural.com.